Let's see. Is this working? I don't know if this is working or not. Let's see. Mm, let's see how this is working. Mm, let's, let's see if I can use this. How do I make it work here? Mm, Let's see. Hold on, I'm trying to figure this out. I'm not sure if this is working. Okay. Trying to figure this out. Let's see. Hello? Does that work? I don't know if this is working or not. Let's see if there's a way of using this WhatsApp group. Let's see. It's on YouTube. Oh, maybe it is working. Oh, okay. Apparently it's working. So, hello everybody. It's March 24th, 2020. My name is Dr. Abdullah, and I'm just doing the coronavirus Q&A, and there's a WhatsApp group that I'm using as well, um, that people can ask questions on. And I cleaned out my board, and we're just trying to figure out, where to go. So I'm just trying to figure out. Let me just 1 second. Okay, I think it is. Let me see if I unzoom this or something. I'm still new at working this stuff out. Is this it? No. Okay. Okay. Maybe it's working. Okay. So there was a whole lot of questions on the WhatsApp group, or if you want, you can also use the live chat. I think it should be working as well. I put in just saying, I just said hello on the live chat. I don't know if you guys can do the live chat or not, but I'm also looking up the WhatsApp group what if people have questions. So someone had a question yesterday on the WhatsApp group about can this get on, can COVID-19 or coronavirus get onto food? And the question is no, not really. So you should the CDC was saying at this time you can't get the coronavirus from food. Now, hopefully, your people who make the food are not sneezing on your food and are not, they're being sanitary. But in general, you should not feel fearful of the food that you eat. Um, you can people preparing your food will not give you coronavirus as of yet per the CDC. So you should feel safe right now of going out and going to your restaurants, doing takeout only. You can't sit and eat, but you can go out and eat and feel safe in that manner, as long as it's a good reputable restaurant and they have a good clean bill of health from the public health department. So that's okay. Now there was a whole bunch of questions from the WhatsApp group. People were asking me questions such as, um, like I have these symptoms, and like I have these minor symptoms. What are the symptoms? I'll just reiterate what are the symptoms again. So the biggest symptoms are again fever. That's done with a That's checked with a thermometer, not something you feel your head. It has to be fever. It has to be then there's coughing. is a big one as well, and then shortness of breath. Now I looked up, I think it was the World Health Organization, and they were also mentioning another another symptom of essentially pneumonia. So like that's basically when the lungs are full of fluid. So that's another one, that could be another one, but hopefully it doesn't get to that point. And I can read out some of the questions that were given out. Let's see, I'm actually just looking at, so let's see, well, there was a whole bunch of questions. I guess I could reiterate some of them here. And they were asking questions like, let's see, one person asked um, about animal transfer from dogs to humans, or from whatever other animals. Now, as of yet, right now, what we believe is this is just human to human, and you can't necessarily give this to your dog or cat. Now, there may be reports in the press, but those are not fleshed out. Those reports are not like the reports that we would literally have to like. Those reports are not like usually scientifically based. Um, uh, as of right now, I have not read anything from the CDC website or World Health Organization saying pets. Now, maybe that's changed in the last couple of day or so, and haven't read it. That's possible. But no, you can't really give this to my understanding is you cannot give this to your dog or your cat or your bird or anything like that. So you should be feeling safe with your animals. Actually, I found a humorous photo online. I think it was on Reddit. In 1918, they even put a mask around their cat. So you don't have to put a mask around your cat. So that's okay. Let's see what else they said on this group. I'm also trying to also look for if anyone out there has like messages. Again, if they want, they can type messages into the YouTube chat. If anyone's watching, I actually haven't gone to my own live chat. Mm, let's see. I don't know. I'm just sort of looking at the live streaming right now. Looks like it says 7 people are watching or whatever. But hmm, I'm actually looking. The picture quality is maybe better on my iPhone than my webcam here. I don't know. It's weird. Anyway, other questions. Let's see. Other people asked. What did they ask? I'm just going by. Let's see. A lot of people had. Let's see. Oh, one of them was, what do we do about like stuffy nose and phlegm? Are these symptoms? No, the major symptoms right now are primarily that of what's it called again? The primary symptoms right now are that of
To
to
fly
fly
a
a
rocket
rocket
ship.
ship. Sorry, that was weird. Um, Sorry, one second. I'm just having a little bit difficulty here with it. But the primary symptoms are those of fever, cough, and shortness of breath, as opposed to some people having phlegm or stuffy nose. No, that's not going to lead specifically to coronavirus or what have you. That's not necessarily saying you have coronavirus. Um, let's see. Oh, sorry, I got a message from one of my friends. Um, and then some people were mentioning about tummy pains. Is that something? No, stomach pains are not necessarily an indicative of coronavirus. Let's see. What else do people have to say? Let's see. And someone was asking about, do coronaviruses, do face mask and gloves help protect from corona? And I said yes, they do. But ideally, your best way of dealing with this is keeping your distance and staying home, frankly, is and washing your hands. And I've been showing my patients here that come to the office about washing your hands diligently um, for 20 seconds with soap. And I have to reemphasize this, that soap is better than hand sanitizer. No, soap is the best. Let's see, what else did people have to say? Um, I also people were asking about other forms of protection, of personal protection, and I mentioned that you can use a bandana. So just literally a mask, like a piece of cloth around your face is fine, and any kind of barrier. What you're trying to do is you're trying to have some kind of barrier between droplets. Um, and so coronavirus is basically spread essentially from person to person via air droplets. Okay, It's the air droplets that spread from person to person. And so if you have a barrier, that's better than nothing. Um, Actually, my mailman that comes in uses a bandana, and he also has gloves on. But it's basically what you're trying to do is you're trying to prevent the coronavirus from coming onto you. And if you don't have access to N95 masks or these other masks, all this really is, if you think about it, is just a piece of paper, really, it's paper, almost tissue, that's covering your mouth from your nose and mouth, the entry points from just coronavirus. So, I'm sorry, I'm just trying to look at. Let's see. Oh, I'm getting a message about it's too zoomed in. Let's see. I'm trying to have it not zoomed in. How do I make it unzoom in? I'm trying to work with this. Let's see. Settings. Is there a way of making it unzoomed? Maybe it's the camera. Maybe I have to play with the too zoomed in. I'll try to. How about this? I'll work out. Oh, the camera seems to focus on my face. That's weird. Maybe make it so that it doesn't focus on my face. Is there a way of doing that? No. There's no way of. I'm trying to figure this out. This is still some glitches here and there. Um, let's see. Toolbars. I think that's not as good as I wanted. Okay, well, we'll have to make do. I'll try to on. Well, looks like the camera wants to focus on my face. God knows why. Um, Not focus. Okay, I'm playing here with this thing. Sorry. Okay, let's not do that. Okay, well, I don't know what's happening here. Let's see. Oh well, I'll have to make do. So, let's see. What Um, so I was mentioning about bandanas are a helpful barrier protection. Oh, this camera keeps doing this unfocused thing. I'll have to get better next tomorrow. I think I'll go back to my iPhone. That is a better way, but I wanted to see messages. So I need to figure out how to play with this camera. Sorry for the technical difficulties here. Let's go back to the messages. Um, Someone was mentioning about using disinfectants, ultraviolet light, ultrasound waves, or laser light, and I said no, that's not good enough. Frankly, that's not the best thing and the easiest thing is hand washing, washing your hands. And again, hand washing helps because it prevents the virus from um, you from getting the virus into you. Let's see, what else is there? Uh, if you're quarantined at home, how should you isolate yourself from your family? Well, quarantining yourself from home is okay. So actually, if you use the Canadian Prime Minister as an example, from what I understand, is his wife is in a room. She has coronavirus, so she needs to quarantine herself from the rest of her family. And from what I've understood is she is in a room by herself, just by herself, and the prime minister is taking care of their 4 kids and also the nation in the rest of the house. So he's washing the dishes, he's cleaning the clothes, he's attending to conferences through Skype or what have you, or FaceTime. I'm not sure how he's doing it exactly that way. Or he comes out on his porch to give public addresses to the nation every day. And how you should quarantine yourself if you know the other person has COVID-19. That's the thing. If the other person, and maybe also if the other person has a fever and has a cough. If the person has a fever and a cough, then yes, that person should be isolated from the rest of the home. Um, because and that's if you don't know if because you don't know if that person has COVID-19. So uh, I would say if that person is showing you symptoms, you could maybe assume that person has COVID-19, and at the same time contacting your public health department, trying to get that test to verify that person has COVID-19. So I would say have them sectioned off into a room, provide for them food, and have them also wear a mask and or basically some kind of barrier protection so their droplets can go to you. So if they're having a fever and they're having a cough, then they need to have a mask and protection whenever you interact with them, giving them food or changing laundry or what have you. and then but having them in a self room. If it's a one bedroom apartment, well then you got to stay. If it's a wife and a husband, that wife stays in the one bedroom, and the husband is in the living room with the kids or by themselves, and doing what needs to be done in the house. If that person has a fever, a cough, shortness of breath, and while you're waiting for a test. Let's see what else is being said. Let's see. What is your opinion about taking hydroquinone and azithromycin if he becomes infected with COVID-19? Um, well, both these medicines are actually only available by a PCP, by a doctor. You can't get this stuff from physicians, first of all. And what are my opinions? My opinions is it's too early to tell. It's too early to tell if this is a definitive treatment. I've heard that. Oh, it's going to focus again. But what I've heard is that as uh, that there's an antiretroviral that's also good, um, but these medicines have to be given under the supervision of a physician because hydroquinone can also cause heart irregularities. From my understanding, I have to do a little bit more research exactly the heart irregularities, but um, I would say it's too soon to tell if this is a good method or not. There may be what's called anecdotal evidence that this is good. Anecdotal evidence is basically just I heard from this guy that this is good. Um, so what needs to be done is a randomized control trial, or it has to be done on more scientific method. And anecdotes are not good enough. So an anecdote is a doctor tried this, it worked. That's it. That's not that's not something you can just give everyone. Maybe there were circumstances that made that person those medicines work, or maybe it was a fluke. Maybe those medicines didn't do anything. I'm not saying hydroquinone or azithromycin doesn't do anything, but azithromycin is an antibiotic. It's not going to kill a bacteria. It's not going to kill a virus. Hydroquinone, I have to do more research exactly how it is uh, preventing replication of the virus or how it's preventing spread. But it, the medicine itself is not something that we are like, oh, this is something standard of care. This is how we treat this virus. Maybe, but at the same time, I actually got a question. I got a person called me on the phone and asked me, can you prescribe me hydroquinone? And this was a month back. And I said, why? Why am I going to give you hydroquinone? And then he told me, oh, there's some early reports that this is good. And I said, well, I'm not going to, you don't have malaria, sir, and I'm not comfortable giving you hydroquinone just because of this. So, and he didn't call back, meaning he didn't like it. I think he was just trying to get it just as an in case kind of thing. Doctors are not just going to give you hydroquinone just in case. So, and we don't give you azithromycin, which is also called a Z-Pack, just in case, um, per se. It depends on the relationship, but yeah. Let's see, what else do we have here? Let's see. Let's see. Someone was asking, will infants have a rash on the face and body temperature of 99.9.6 and a dull voice? About it looks like this was from the this, and they're just asking about symptoms. Again, it's close to a fever, but it's not yet a fever. And a rash on the face or the body is not an indication of an infection of an infection of COVID-19. Let's see what else. What person, if the person is healthy and asymptomatic and might be transferring the, what should be done in this case? Oh, well, that's why that's we need more testing. Oh gosh, I gotta focus again. Is there? Should I get closer? Maybe I'll go unfocused. Sorry. Let me play with this. No, I think I need to tell the camera not to do this. But anyway, it's a little bit better. Um, so what if the person is healthy and asymptomatic, might be transferring the virus to others? Well, that's where that's a conundrum of this problem. That's why we are trying to. That's how why it's so hard to slow this thing. Well, that's why social distancing is important. That's why staying at home is important, and that's the issue. Like anyone can have actually this virus. And let's um, like what you should do in this case is um, basically just keep your contacts as minimal as possible. That's what you should do in this case. Keep your contact as minimal as possible, and if you have to contact others, um, you know, uh, you can use barrier protections, or if you know someone's sick, don't go to their home. Um, just it's one of those things. We're hoping that social. That's why there was a video actually. I'm not sure if anyone's seen it, but there are Italian mayors who are cursing at their constituents, saying "Stay home." There are people in Florida. There was a video of a bunch of spring break kids saying that I don't care about COVID-19. I don't care about this. I don't care about that. I'm going to go to the beach. It's my spring break. And then I believe the governor of Florida closed down the beaches because of them saying things like this. And that's why you shouldn't go to a beach. You shouldn't go to crowded places. You should try to avoid. I know this is huge. Like, you know, you got to live your life, but at the same time, we got to change things for hopefully a couple of months. I don't know. I was actually doing research on the internet and the about the Spanish flu, and it took about 3 months for the big spike of cases and deaths to happen. So we're only technically into month one, and if this is month one, and we got a couple of months, month one, May, April, June, sorry, April, March, April, May, June, July. So maybe 4 months, July. Um, and it looks like one of my patients is calling. She's running behind. Okay, sorry. Hopefully you don't hear that, but that's one of my patients calling. She's supposed to come at 1. Anyway, I digress. Let's see. What else is being asked? Let's see. I work IT in a hospital. I go to work every day and I live with my parents. Would you recommend I isolate myself after going home? Ah, uh, this is hard to answer. I would say it's it depends on how. I would say one, if you work in a hospital, you're basically like in my boat. You need to wear protection. You need to be wearing masks as best as you can. You're around sick people. Sick people come to a hospital. Sick people come to my office. I change my clothes. So I would say maybe you could do what I do. Um, One, wear personal protection. You know, stuff like this. You can go out and get. You don't have to get scrubs. Just change of clothes. You can get pajamas. I don't know, whatever's. I'm sure if you work in a hospital, you can find scrubs. And no one should wear clothes like this and then change them out. Um, Wash your hands frequently. Um, and if your parents are sick or elderly, um, uh, if you want, you can wear a mask all the time. I can tell you, I live with my wife and my daughter, and we change these clothes. I change this. We have a garage, so I change this in the garage. Change this in the garage. My pants. I These stay in the office. I wash my hands. And I have not isolated myself, honestly. Um, I don't know. I don't. This is iffy. This is a judgment call. If you feel that you need to isolate yourself, then you can. But if you think if you're okay, then and you're taking enough precautions, I think it'd be okay. There's a fine line you have to run here. So it's a difficult question for me to answer. Because I don't know if maybe your parents are elderly, maybe they need your help also. So just be careful out there. So let's keep going. Let's see. Oh, what's that? What is this? Uh, what? Let's see. WHF is not available. I don't know what WHF means. Um, I don't know what that even means. You'll have to change the acronym. Uh, I don't know what that is, so you'll have to. I don't know what that means. Okay, let's see what else. Let's see. Oh, there was one question about pregnancy, and okay, if you're pregnant, your baby is safe. Okay, um, you have to protect yourself, of course, as a mom. But no, you're not going to give the coronavirus to your baby. It's a respiratory ailment. It doesn't go to your baby. Um, and you know, when you go to your OBGYN or when you go to deliver your baby, they will take the necessary precautions. But no, you will not, God forbid, if you had corona, would pass it on your baby. There is no way. Your baby's lungs, frankly, are flat or folded flat inside. So that's about now. We're about 1:30 or 1 o'clock. Sorry, about 30 minutes into it. Looks like maybe a question is coming in. I'm still going to be working on the technical difficulties in regards to the my camera and uh, I'm still working on that kind of stuff. Oh, there's one last question. Why are men more affected than with COVID than women? Um, I don't have enough data about that. I don't know if that's actually even the case. I would have to, or is it more common with flu in general? Um, I don't have an answer for that. Um, why men are affected more than women? Uh, I would have to look that up if there is a gender biasy. I would imagine there shouldn't be. Frankly, I would imagine they're both equally susceptible. But I would actually have to look that up. I don't have the answer for you in that question. I'll tell you when I don't have the answer. I don't know, and I'm gonna tell you I don't know. I have to look it up, just like everybody else. And looks like they're sending some kind of post about this. I'd have to read the article more closely and see what the case may be. But there could be other underlying circumstances, such as the men are more apt to going out in public than the women. Maybe the women in this article are more at home and not exposed to as many people as say the men. Maybe they're going out doing things and they're interacting with more people, and that's why again the social distancing. The women are sort of more socially distant than the men, and the men are more getting infected. I don't know. That might be the answer. I'd have to look at the article closely. But okay, well, it's about now 1:02. I'll do this again tomorrow, and uh, you know, we'll go from there. And I'll try to fix up this image issue. I know it's still doing this wackiness with me. Thank you again, and bye bye.